What exactly is vaginismus? A sudden tightness or spasm of the vaginal canal is typically called vaginismus. Vagina generally is an open space, and vagina itself is a smooth muscle. Under the right context, it should allow space for a doctor's exam, for inserting a tampon, or for penetrative sex. But in some conditions, the muscles around the vagina become tight, or the vaginal tissue itself becomes painful or is irritated, which makes it so that the body fights any vaginal penetration with a muscle guarding response, which closes the opening, right? And it seems sudden, it seems unintentional, meaning sometimes you are desiring that activity. You want to put a tampon in, or you want to have penetrative sex with your partner, but your body just doesn't cooperate, which is what makes it feel like it is involuntary, meaning something that you can't control. But what it is essentially your body is protecting you against pain. And then the way it protects it is by suddenly guarding with a muscular spasm, and that's what's typically called vaginismus.
What causes vaginismus?
The causes of vaginismus, there are many. Vaginismus is essentially a symptom and not a diagnosis. Vaginismus is when your body is fighting with muscle spasm in response to pain or fear. So it can happen if there is any reason to cause pain or fear. So typically we look at medical reasons and psychological reasons and cultural or social reasons. And here's how it goes. Some people have a medical diagnosis, like, for example, a vaginal infection or a yeast infection or a urinary tract infection, or they have PCOS or endometriosis or other medical problems which are causing a source of pain, which then makes the body respond with muscle guarding and spasm. For some people, it is partially emotional or psychological, meaning they're scared, they're afraid, they have anxiety, they've had history of trauma, they've had history of assault, or they have had other emotional challenges, which is making their body show those struggles in the form of closing down, right? So vaginismus has physical reasons, and sometimes it can have emotional reasons, and sometimes it's combined and it's together. So there are multiple causes or reasons of vaginismus, and it requires a deep understanding of that patient's history, that patient's life, their experiences, their medical review by a doctor to kind of figure out what might be happening for an individual in front of us.